Hello, everybody. Welcome to the Lindsay Leg Club podcast. My name is Frank Guerriero. I am a nurse practitioner with the vascular surgery team in South Australia, working out of the Flinders Medical Centre. This is the second of a two-part series of podcasts where I'm talking about peripheral vascular disease. In my first podcast, I talked about peripheral arterial disease, so the vessels that supply blood to your peripheries and to your organs, to your body. And today we're going to talk about venous disease and the difference between venous disease. So just before we go any further, I'd like to very much thank the Lindsay Leg Club for the honour of being able to speak to you all and share my knowledge with you all about this topic. So in my previous podcast, we talked about the difference between arteries and veins, and that arteries were generally high pressure hoses that could cope with the pressure being connected from the pump and taking blood away from the heart and out to the rest of the body. And that veins are more like a thinner structured, thinner walled vessel, which the role of which is the sewage system of the circulatory system. So veins take away the waste products of your cellular metabolism and clear away old fluid, etc., and bring that back to the body, up through the legs, through the stomach, or down through the arms, back past the liver for it to be clean, back through the kidneys for it to be clean, and then into the right side of the heart where it can be pumped into the lungs so that it can be oxygenated and then be pushed back to the left side of the heart and back out through the arteries again. So just as a brief recap, veins are a low pressure system. They have one-way valves in them that when the heart relaxes prevent blood flow from going back in the wrong direction, because in particular in the legs or any part of the body that's currently lower than the level of your heart, the resting pressure inside a vein is a lot lower than what it is in an artery, and in fact it's so low that gravity is stronger than that residual pressure, and that means it can pull the blood backwards down towards your feet or down towards the earth. So if you're sitting down or standing up, that can happen. Of course, with one-way valves, they shut when your heart relaxes, and that stops the blood from running in the one direction and generally keeps the blood flowing in one direction, so we don't end up with our legs full of fluid, full of blood, and looking a bit awkward and weird, which is kind of good. When we're talking about venous disease, in particular peripheral venous disease, we're talking about veins generally in the legs. Tend to see too much problems in the arms because they're not quite as adversely affected by gravity and the pressures that play around and play havoc with your venous system. So generally, it's something that affects the legs. In a very basic metaphor or a basic context, venous disease can be akin to something like a river bursting its banks. When we have problems with arterial disease, that's about blockages and narrowing and tightness and lack of supply. And when we're talking about venous disease, we're talking about too much pressure in the venous system and the venous system being overloaded. And therefore, these flimsy or thinner walled vessels can stretch and distort and become corrupted and therefore potentially leak out of the circulatory system, and therefore we have blood leaking out of this system into spaces where blood's not meant to be. It's a bit like a river bursting its banks and causing damage to the surrounding area or near the river, in a flood. It's the same kind of concept that we're talking about with venous disease, so quite different in nature from arterial disease. So what are the kind of things that can contribute to this bursting of the riverbanks or too much high pressure in your venous system that causes that rupture or bursting or corruption? Well, if we have a lifestyle or an occupation that causes us to be static, i.e. we don't move around much, that will contribute to a higher pressure in our venous system. You see, The venous system needs, whilst it's got one-way valves to reduce that pressure, it also needs our muscles to be moving, to be squeezing and contracting, expanding, and that helps push the blood back out of our veins and up towards our abdomen and back into our heart. So if we do jobs where we're standing around in one space and not using our legs much at all, or sitting down in one space and not using our legs much at all, then we will potentially be at risk of developing venous disease, as the static pressures within those veins will be increased. Similarly, being overweight can contribute that too. Lots of weight, in particular around the abdomen area, can press against the veins that are draining back into the abdomen, and that can cause higher pressure in the veins in the legs and cause venous disease in the leg as well. If there's been a change in the way you walk, and in particular where you don't use your calf muscles, so that classic heel and toe movement when we're walking, rocking onto the top of our toes and then back down onto our heels, that causes the calf muscle to pump. If you can imagine a leg standing in high heel shoes, it makes the calf muscle quite prominent, and that's because the foot is artificially elevated. And of course, if you take the high heel shoe off and sit down, the calf muscle relaxes and it disappears or is less prominent. You can't see it as easily. Okay, so that lifting up and down and standing motion and that contraction of the calf muscle ejects blood out of the leg. And if there's anything that interferes with that, say a trauma that causes damage to your ankle, or you have to have surgery because of arthritis to your ankle, or even just old age or becoming a bit more frail and needing to walk around with a frame to be a bit more secure, you'll often find that will shift your gait to a more shuffling kind of gait, and you won't be using your calf muscles as much, and in turn that will potentially contribute to the development of venous disease. You can be genetically predisposed to venous disease. If you've got a family history of mum or dad having varicose veins or leg ulcers and those sorts of things, and that's a bit of an indication that maybe genetically those valves, those one-way valves of the vein walls, just aren't quite as strong as perhaps other people's are, and so you're predisposed to venous disease. If you have any blockages in the deep venous system, known as a deep vein thrombosis, so if you've got a history of a deep vein thrombosis, that can predispose you to venous disease as well. And again, the concept is that there's a blockage from the vein thrombosis that increases the pressure downstream, and that causes problems that will cause that river to burst its banks. And then, of course, any lower limb surgery or surgeries on the venous system that need to occur, in particular the deep venous system, that might damage or ruin it, that can cause high pressure in the venous system as well. So these are the kind of things that can contribute to lower limb venous disease. What are some of the symptoms of lower limb venous disease? Well, interestingly, one of the most common ones is actually quite similar to arterial disease, which can make things a little bit confusing. But yeah, you can have hair loss. This time, though, rather than a lack of blood supply causing the problem, this is due to an excess of fluid and poor drainage of wastes from your lower legs. So swollen legs, thick swollen legs, that can result in hair loss as well, because the hair follicles are not getting enough nutrients to survive, and so they potentially die. There's another skin change which has a really fancy name, and it's called lipodermatosclerosis. And that just basically means hardening or thickening of the skin. So if we have chronic venous disease, if you imagine that you've got a structure like a lattice that's being stretched and pulled to its very limits, your body will try and repair that lattice structure. And if this process of stretching and decreasing and stretching and swelling, so if we get a cycle of swelling, increasing and decreasing and increasing and decreasing, which is what can happen with venous disease, we get the body responding to that and trying to stitch up that lattice being stretched apart by trying to make it stronger. And of course, that turns out to be thickening of the skin. And unfortunately, this is a type of fibrosis which can predispose the skin to injury. And then when it gets injured, make the injuries a lot harder to heal. And this is why we often see wounds being chronic and difficult to heal in patients with venous disease. Okay, so that was called lipodermatosclerosis, and if you ever see a patient with venous disease, or if you yourself have venous disease and you're concerned about this, you can run your fingers down your leg from an area of fairly normal looking skin down across the patch that feels a bit woody and hard. And if you feel a clear texture change, it's most likely that's what you're experiencing there. Now, this is also slightly reversible with appropriate treatment, but depends on how long the process has been going on for us. If it's been going on for a very long time, it might not be completely reversible. The other thing that we often see is a discoloration of the skin, like a darkening port wine kind of discoloration of the skin. And often it happens around areas around the ankle region, but it can happen in funny little focused spots around the leg as well. And they are often attributed to areas where the river's burst its banks, so where you've got a varicose vein or a vein that's not working properly anymore. Either its valves are broken or it's just under too much pressure and it's leaking outside of its boundaries. This is called hemosiderin staining, and that discolorization, or that discoloration rather, is a result of the blood leaking outside of the vein into a space where it's not to be, right, out into the tissues, near the muscles, near the skin, and your body breaks that blood down, and the byproducts of that blood breakdown are this brown discoloration, this iron staining of your skin, which we call hemosiderin staining. So the severity of this brown discoloration, and if it's accompanied with that thickening or hardening of the skin, is an indication of how long or how severe the process has been going on for. One of the more common symptoms of venous disease are varicose veins. And varicose veins are where you get too much pressure on the wall of the vein and it bubbles and corrupts and looks all swollen, and often these are of the veins that are close to the surface of the skin, so they can be quite unsightly. A smaller version of varicose veins are spider veins. So spider veins are often an early symptom that there is, excess pressure in your leg, or you're spending a lot of time on your legs without that calf muscle pump or without enough time with your legs being relieved. So bigger, larger, ropey varicose veins in more severe cases can actually be potentially dangerous. There are some stories of patients that have had severe bleeds from varicose veins, and they bleed often quite profusely and quite severely because the veins under a lot of pressure, and there can be a lot of fluid, or a lot of fluid volume in that venous volume, that venous vessel. And if the vessel is close to the skin, it can be at risk of being damaged and opened up really easily by just from a simple knock on a sharp piece of furniture or a thorny bush out in the garden, etc. Limbs affected by venous disease typically have swelling. And again, this swelling is related to that river having burst its bank and that pressure not being able to be relieved in the venous system. And if the one-way valves are not working properly, then the fluid pressure will build up, and you won't be effectively ejecting or getting rid of the fluid within that venous system. Some patients with venous disease can experience pain in their legs, in particular when their legs are down. That might be whether they're standing up or have their legs dangling over a chair when they're sitting. And it's quite common for patients with venous disease to experience pain relief when they put their legs up. And when you think about it, they're defeating the power of gravity and lifting their legs up and letting the fluid drain out of their legs, which will give them some degree of relief. Now, that's opposite to what patients with arterial disease experience, where they're using gravity to help get the blood down to their leg because there's a blockage from the pump side. Venous disease is where there are problems with the drainage back into the body, and so that's where you get swelling and you can get pain when your legs are down. And of course, the sort of end point of all of this skin changes, this bursting of the riverbanks inside the veins, and the leaking of blood out into the spaces outside of the venous system or outside of the circulatory system, is ulceration. And this ulceration is a perfect storm of those ingredients Venous ulcers tend to appear where the river banks of burst are the worst. So that generally is at the lowest point of the leg where the venous disease is affecting. So we most commonly see these on the inside of the leg and down near the ankle, what we call the medial malleolus or the gaiter region of the lower leg. So that's down around near the ankles up to about sort of mid calf. And if you think about it, this is where gravity is having its strongest effect. And if the valves are not working properly or the pump's not working properly for any reason, this is where the pressure will be highest and the problems will be the worst. And so if we get an ulcer in this area, the skin will potentially break down, whether you just bump it or nick it, or sometimes it just happens spontaneously. There's too much swelling and too much pressure. The skin's too damaged and compromised from all these other things that I've just talked about, and so there's a breakdown. The skin can also be sometimes very dry and cracked and flaky, and it's kind of funny because if the skin integrity is damaged from little punctures or little nicks or fingernails touching them, then you can get a lot of fluid coming out of these wounds, but the surrounding skin can actually be quite dry and cracked, and that can also contribute to further ulceration happening. So, funny enough, moisturizing the skin of legs that are affected by venous disease is actually really important. I guess a couple of key things about venous ulcers as well is what I've described, this river bursting its bank and this leaking of blood and the products inside blood out into spaces that they're not meant to be. Your body reacts to that with an inflammatory response. Your body reacts to that with an inflammatory response. And this means that there's a war going on around this area. Your body's regenerative properties are trying to restore balance and trying to heal the wound. But all this time, the river's banks are bursting. So the emergency workers that are trying to fix things are doing this in this very hostile environment. And that makes it very difficult for the wound to heal. It also means that the fluid that's coming out of these wounds that potentially leaks onto the surrounding skin or isn't controlled very well, and you know that there's often a lot of it because the rivers have burst their banks, there's a lot of fluid there, it's quite hostile. And so you can often see extension of the ulcer or damage to the surrounding skin as a result of this wound fluid from venous disease sitting around the skin. It's just very, very hostile. And this hostile environment is also sets up things to be a very poor wound healing environment. So what are some treatments for venous disease that you can potentially do at home? Well, walking is pivotal. And when we're talking about walking, it needs to be the kind of walking that really engages that calf muscle pump. You need your muscles to be stretching and extending and stretching out and collapsing to really push that blood back out of your leg. If you have a look at Google and look up lymphatic massage, there's something else that you can do to contribute to draining the fluid, the excess fluid from your legs. And it's actually very simple, doesn't require a lot of pressure, and it doesn't really take a lot of education to get right either. But so lymphatic massage is something else that you can easily do. You just simply YouTube it and have a look and get some techniques from that. The other thing, and I guess the gold treatment for venous disease is compression, in particular wounds in their early phase, because compression, we can get some traction in regards to getting some early wound healing happening and getting some of that fluid, some of that river water, that bursted banks out of the leg and onto healing. So whether it starts as compression bandages, which is what we typically do for patients that have wounds, and that's because the fluid that's coming out of the wounds, if you were to wear stockings, it would stain your stockings all the time. You'd have to own tons and tons of pairs of stockings, and these stockings are not cheap. So it's not really a viable thing, whereas bandaging systems are disposable and they're customizable. If you think about your leg being, this swollen diameter because the river's burst its banks, and you wrap it up in a nice elastic band, and that pushes out the fluid and decreases it, you're going to see a decrease in the circumference of your leg. So the shape of your leg will change. And the nurses applying the bandage the next time will need to be applying the bandage at a more narrow circumference. So again, when you have an ulcer, or even in the early stages of quite severe venous disease where the swelling's not really terribly well addressed, bandaging is often a good way to go, because rather than you buying stockings that will not fit within several months because you've gotten rid of a whole ton of fluid in your legs, bandages are disposable and they get the job done. I perhaps haven't made it crystal clear how compression works. I mean, very simply, it applies an external elastic bandage around, or an external elastic force from a stocking around your leg, and that just basically squeezes the fluid out of your leg. It increases the compression and decreases the pressures of your venous system inside your leg. It also means that when you do use your legs in exercise when you're wearing compression, that the ejection of the blood, the movement of the blood out of that burst bank river, is a lot more effective. Finally, vascular surgery is something that can be effective at treating, in particular, varicose veins. One of the most common treatments for varicose vein is ablation of the vein. So that's taking that burst river vein and actually destroying the whole river completely. It seems quite drastic, and people think, oh no, well, don't I need those veins? Yes, we've got a lot of other veins that can take over and help drain it. And so fundamentally, you're filling in the riverbank that's burst its banks, that's no longer working appropriately, and shunting the runoff of that fluid to a venous system that is working appropriately. I won't talk today about the more severe cases of venous disease where surgeons will potentially use stents, etc. But it is probably good for clinicians in particular to have on their radar that sometimes when we treat varicose veins effectively, but we see recurrence of ulceration or recurrence of venous symptoms, venous leg ulcers, that we might need to have another round of the surgeons having a bit more of a further look further up the body to see if there are venous blockages up the body that the surgeon may want to do something about. But I'm not going to go into that today. I just put that on people's radars that there can actually be femoral vein or iliac vein occlusions or stenoses that surgeons could potentially look at, and it's quite common in patients that have recurrence of varicose veins, in particular after a surgeon's treated it. A lot of people will seek out cosmetic treatment of spider veins or large varicose veins. In general, this is a fairly low risk situation, but again, it's worth considering what it is that's contributing to the development of that disease state. What is it of those risk factors that you might have in your life that you can potentially change to avoid further development of varicose veins or spider veins in the future? As whilst we can treat them with chemicals and surgeries, they'll only return if we don't address those overarching issues. So in summary, venous disease is a disease of the sewerage system, of the circulatory system of the blood vessels, where the veins are under too much pressure. They're not draining effectively, and that might be because of a static lifestyle, being overweight, changes in the way that you walk, or a family history or a history of deep vein thrombosis. And these things can ultimately lead to too much pressure in the venous system, which causes them to be overwhelmed, which can then mean that the river or the vessel, the plumbing system itself ruptures and starts leaking blood and blood products out into the surrounding tissues, which can then cause problems such as skin changes, hardening and thickening of the skin, discoloration of the skin, thick swollen varicose veins which can bleed easily if they're knocked or damaged, chronic edema, which we call, or swelling as we call it, pain when the legs are down, and in more severe forms of the disease, wounds or ulcers as we call them. They're an interchangeable term, and these ulcers are often very difficult to heal unless they receive appropriate attention. The most common treatment for venous disease is compression. You can also employ things like walking or engaging a physio to do lower leg maneuvers and movements to improve your calf muscle pump and ejection of blood from your body. You can have a look into lymphatic massage, and in severe cases, or for those wanting to address things cosmetically, you can speak with a vascular surgeon. Thank you very much for your time today. I greatly appreciate it.